Okay, good morning, everybody. Welcome to the forum at All Souls Unitarian Universalist Church. We have been meeting here on Sundays for years and years and years. And the very first time I ever stepped inside the building would have been oh, i- about 1970 or so. And it was to come to a forum. So we're very pleased to see all of you. Our forum has existed for a long, long time. And it came about because we wanted to have a place to discuss significant issues. And we also wanted to have something where not only did we have a speaker, but we could have some interaction with the speaker in the form of questions at the end. So we'll follow our usual thing of we'll have our speaker. Actually, we'll have someone else introduce our speaker, and then we'll have a break then and we'll have question and answer. So what I'll do is go ahead and let you introduce our speaker, and and then we'll I'll say something right before you start to talk. So I'll stand over here with my I'll block the picture. But the usual thing is I have trouble walking, so I always have a walker here.
Good morning, everybody. I may look familiar because I've been here a couple times, but in a different capacity. I serve as the principal of Carver Dual Language, which All Souls sponsors and helps tremendously with the amount of volunteers and different activities throughout the year. So, my name is Andrew Murphy. But in my spare time, not serving as an elementary school principal, I serve on the board of directors for Health Ed Connect, and so I am happily introducing Emily Penrose-McLaughlin. And she is our executive director of Health Ed Connect, which is a Kansas City based nonprofit empowering women and children through evidence based health, education, and advocacy. Emily will share about the organization's partnership with volunteer community health advocates in 4 countries to connect vulnerable populations with essential health and education to promote thriving communities. Emily earned a master's degree in public policy and management from the University of Pittsburgh Graduate School of Public and International Affairs, with an emphasis in nonprofit management. She and her husband Jeff lived in Zambia for 1 year as volunteers and traveled to many of the areas where Health Ed Connect volunteers and programs now serve. Emily and Jeff have 2 children and hope to instill a genuine care for people and planet. And being a attending Graceland University around 15 years ago, I had the privilege of doing one of my student teaching practicums in Zambia and seeing firsthand some of the volunteer health workers in their work, in their daily lives, and how they take care of their communities. And that's what got me hooked in the story and the power that is Health Ed Connect. So uh, I'm really excited to have Emily share with all of you today.
I'll interrupt again just briefly to make some comments. I'll mention a little bit about what my situation is. Two of my grandchildren have grown up in France and speak multiple languages, as most people do, other than Americans. And so they, in fact, have visited me here sometimes and came once when we were going to have something with youth. And so they ended up being part of a forum that they hadn't really planned to be on before. So we're very pleased to have a forum speaker. And then again, our speaker she'll talk. And meanwhile, be thinking of all the questions you want to ask. They can be easy questions or they can be really difficult questions or they can be something in between, but our speakers always are able to take care of our questions. And then when she's done, we'll have a break and we'll have an offering and we'll have more opportunity for discussion with things.
Thank you. Good morning. I really am grateful for the opportunity to join you this morning and grateful for the opportunity to share with such an engaged and thoughtful group who are discussing topics that matter not only in our local community, but in the world. And so thank you very much for the opportunity to share today. As has mentioned, our organization works on empowering women and children through health education and advocacy. And how do we do that? We work on partnering with over 150 volunteer community health workers serving in 4 countries. Three, which are in sub Saharan Africa, Zambia, Malawi, and the Democratic Republic of Congo, and also in South Asia in Nepal. We equip volunteers with training in World Health Organization endorsed primary care to address basic health conditions and health education, such as first aid, sanitation, nutrition, illness prevention, infant and child growth monitoring, prenatal and postnatal monitoring, and participatory research to conduct community interviews about the greatest threats to the health and well being of children and adults. Participatory research values the lived experience of community members, empowering them from the start as the experts in their own community to provide evidence of the most pressing concerns. So we are grassroots led. We listen to the wisdom shared by the community members and partner with volunteer health advocates in supporting their efforts to address community needs with research backed information, best practices, and resources. We don't step in, take over, or do it for them. And in the process, self confidence grows, women's status is uplifted, and leadership is developed and locally directed. To back up a bit, one question might be, well, why or how did you get involved in this work? And the simple answer is that because there is a serious and critical need to connect access to health and education for people who either lack access, understanding of how to access, or the resources to improve the situation. We are 15 years young as a registered NGO, but our experience goes deeper by another 2 decades through the work of our co founders, Sherry and Jack Kirkpatrick. Sherry earned her doctorate with a focus in international nursing while researching the health beliefs of Haitian mothers living in the Dominican Republic, women who desperately wanted to improve the lives of their families and their community, but weren't sure how to get started. So she worked with the women to launch a volunteer community health worker program based on participatory research. Throughout their careers, Sherry and Jack developed connections with women and men in other places who also shared a deep desire to improve the health and well being of their family and community. Education and empowerment were key so that the knowledge would be maintained and shared locally. So they began training volunteers based on World Health Organization guidelines for village health. Each group took on a unique emphasis to address the greatest concerns and health threats identified by the community members. In the Democratic Republic of Congo, one of the biggest problems being faced for women and families was a very high maternal mortality rate. In 1990, for example, there were 879 maternal deaths per 100,000 live births, starkly compared in the same year to the USA with 12 maternal deaths per 100,000. In response and in collaboration with the local Ministry of Health, resources were provided to train community members as traditional birth attendants to support women and babies through pregnancy, childbirth, and in the weeks and months following. volunteers became skilled in how to recognize determinants of health and risk factors and when to triage a mother to the hospital. This has led to a decrease in the deaths of mothers and babies, and over the past 9 years, 20,263 babies have been safely delivered by these volunteer health workers while keeping moms healthy. Today in the DRC, we partner with our volunteers based in Lumumbashi, which is in an urban city setting, as well as in the Kisenga district, which is in a rural village setting. And they have built a positive reputation with the local Ministry of Health as reliable and skilled community health advocates, and they volunteer at government health clinics and birthing centers. Many of the volunteers have also become trained to administer vaccines. And our team leader, Josephine, is a coordinator of vaccination campaigns. In Malawi, one of the biggest issues has been severe malnutrition and stunting in children. Stunting is defined as low height for age as a result of chronic undernutrition and care in early life and prevents children from reaching their physical and cognitive potential. The response was training volunteers to educate mothers and caregivers about proper nutrition as the building blocks for healthy children, sanitation practices to prevent illnesses, and how to make life-saving oral rehydration solution when faced with diarrhea and vomiting, and the importance of weighing and monitoring children from birth to 5 years to ensure they are developing along the growth chart. Last year, our volunteer health worker colleagues in Malawi weighed over 60,000 children, and among them, 336 were reported underweight, which is less than 1%. The national averages for children in Malawi are 12% underweight. So, why are their averages less? Well, the volunteers make a plan to follow up with the caregiver and the child who is underweight and falling behind on the growth chart, implementing interventions to improve their nutrition and get them back on track for their development. And so their success rate has been extraordinarily high. In Zambia, the critical issue community members raised was the crisis in caring for so many children orphaned because of HIV/AIDS sweeping through the nation, especially in the Copperbelt province as a trade route for copper mining. At least 1 in 10 in the population are orphans who have lost one or both parents. While our community health worker partners were conducting visits to provide basic home based health and palliative care, they found many children at home who should have been in school. Most were orphans being cared for by an elderly grandparent or extended family member, trying their best to care for the children with very few resources to even feed the children, let alone send them to school. Although government schools are free to attend, children must provide their own uniforms, pay for books, and provide their own lunch, and there are other school fees. The community health workers went home to home interviewing community members about the greatest threat to the health of children and adults, and the resounding response was lack of access to education. At a community meeting to discuss the interview responses, one of the caregivers said, and others replied in unison, "We might be hungry tomorrow, but without education, our children have no future." So, starting in 2009, the first community school program was established to provide access to primary education for orphans and vulnerable children. It started as a 1 room schoolhouse led by volunteer community health workers in a local church teaching the basics: how to read, how to write, and do simple math. Children of all ages came with an eagerness to learn, starting from the same level, whether they were 5 years old or 15 years old, because most of them had never been to school. It was in that same year, 2009, that Health Ed Connect formally became established as a nonprofit to bridge access to health and education and support the growing volunteer community health worker initiatives addressing community needs. Since then, the school programs have grown into 3 registered community elementary schools with trained teachers and over 1,600 students enrolled. The purpose of the schools continues to be to provide access to orphans and vulnerable children who would otherwise not be able to attend. A unique and powerful thing about these 3 schools is that the volunteer community health workers continue to be involved in programs for the children. There are several wraparound programs at each school to provide enrichment and nurturing care, which are either facilitated by or supported by the health workers. They are often involved in making nutritious school lunches, which are provided for free and are critical because it might be the child's only substantial meal of the day. The health workers also requested and received training to facilitate a grief support group for orphans at the school because they noticed children who were coming to school but crying or not engaging in activities because they were sad and grieving the loss of a parent. In the grief support group, the community health workers provide a safe place to process and share feelings and build friendships. Many of the children call the community health worker leading the group Mama Madam because they feel so loved by the health workers. Another key program that has developed at the schools is the Girls Achievement Program, which is a weekly program for girls in grades 5 through 7, facilitated by the community health workers and teachers to empower girls with education about their development, build character and teamwork, and emphasize the importance of avoiding early marriage and staying in school, a message which is also shared with the girls' families. A wealth of research tells us that every year a girl stays in school significantly reduces her odds of early marriage and pregnancy and increases her long term economic growth and health outlook. The impact of a girl's education not only improves her life, but also that of her family, her future family, her community, and the nation. High school scholarships is another area that has grown. And this investment in girls' education is why the majority of our high school scholarships are reserved for girls to continue their education, leveling the playing field for girls to reach their educational and vocational goals. This year, 126 students are in high school, with scholarships and academic tutoring provided by Health Ed Connect. These scholars are graduates of our elementary programs and call themselves the Keeping in Touch Club because they return to our schools each week for tutoring. Several graduates have had the opportunity to further their studies into college, and we celebrate their accomplishments. But we also know that many youths won't have the opportunity for higher education, and noting the high unemployment in Zambia, most will find it difficult to land a job. So it's very important for youth to learn vocational and entrepreneurial skills to help market themselves. Schools are already teaching some of these skills, and we are working with one school in particular to take the vocational and entrepreneurial training to the next level with a vocational skills center. Jumping to the other continent where we work in South Asia, we also partner with volunteers in Nepal. The major concerns identified in the regions where they live have include lack of access to healthcare in remote and hard to reach places, respiratory issues caused by traditional cooking methods indoors, and illnesses caused by poor sanitation. In response, volunteers have been trained to provide basic health care, educate community members, particularly women, about a range of topics and illness prevention strategies, and encourage community members to adopt safer methods for cooking using vented cook stoves and improve public health through the use of latrines. Following the devastating earthquake in Nepal in 2015, our health worker colleague Ram Prasad noticed a staggering illnesses being caused by poor sanitation in his village. He made it his mission to educate community members about proper sanitation and advocated for support to build latrines so that there would be sustainability in community health long term. Since then, he has helped families build 45 latrines in the village. And these are not small projects. There is a lot of sweat equity that goes into digging for the septic tank and the flow system and the structure of the outhouse itself, not to mention bringing the supplies up a mountain to this very remote area. But for the cost of only $250, one latrine should last for 20 years and then be able to be reused after cleaning to keep working well into the future. A really good investment. What I've shared today is just a small glimpse of the critical need for connecting access to health and education and the incredible efforts of our volunteer community health worker partners who are making that connection in their communities. This makes a long term impact not only in individual lives, especially for women and children who are among the most vulnerable in the population, but collectively for the community and the nation. We are working to do our part as a nonprofit to progress the Sustainable Development Goals developed by the United Nations in 2015 to reach by 2030. Our work especially focuses on the top six initiatives. One of the goals is to end extreme poverty, which is defined as living on less than $2.15 US equivalent per day. This year is the midway point to assess progress toward the Sustainable Development Goals, and the world is unfortunately not on track to meet those goals, largely attributed to setbacks caused by the COVID-19 pandemic. Nearly 700 million people around the world live below the extreme poverty line, and just over half of that number lives in sub-Saharan Africa. Children are especially affected by extreme poverty, comprising more than half of that number. Countries cannot adequately address poverty and inequality without also improving people's well being, including through more equitable access to health and education. And that's where we feel we can support change. Nonprofits provide support where governments cannot or will not to extend the social safety net, uplifting the basic needs and rights of people and the planet. And so we focus on sustainability through empowerment and partnership. And that is where I will wrap up my long comments. I can talk at length about our programs, but I do encourage you to please address any questions that we can share and discuss together. I have also left some materials on your chairs to learn more about Health Ed Connect, a postcard, and this is a way to sign up for our weekly, very short newsletter with some of our impact stories from our volunteer community health worker colleagues and some of the people that they work with in their communities to hear from their experiences directly. So I encourage you to take a look at that. And we also have our annual report, our last annual report, which I've set on this table over here, that goes into detail about our our financial transparency and some of the stories of our colleagues, and support that we receive. So thank you. Thank you very much for the opportunity to share.
One of the important things we always have a little break for is money. And we know that money is always important to everything. And so we're going to have a collection taken up, and that helps support the forum. I want to make a few personal comments about things. When I say two of my granddaughters grew up in France, and so they know multiple languages. They don't know, they didn't know any medical things. And they were with me at a movie theater, and I broke my ankle. And so I ended up being dragged by somebody down to some first aid room, and then they ended up calling an ambulance to get me. And so my granddaughters were maybe 3 and 5, maybe a little bit older then. And so they chattered away with everybody when we were in the ambulance. They didn't really know anything about things, but they asked what everything was, and there were people who were very nice to them. And then eventually we got to the hospital and things got worked out. Well, later they lived in an apartment that was 66 steps from ground level. And I became very familiar with that 66 number because if I ever went out and went back, I had to crawl up the 66 stairs to get there. And so they were quite pleased with themselves. I said, "What would you do if there were a fire? How would you get me out of here?" And then they were like 3 and 5 then. And it's amazing that children actually, and we saw children there, are able to do a lot if they know just a little bit. And they said, well, we'd get a blanket and we'd put the blanket at the top of the stairs, and then we'd drag you to the blanket, and we'd put you on the blanket, and you'd hold on to the blanket, and then we would drag you down the 66 stairs. And I thought, oh, I hope there's not a fire. But children are actually capable of figuring out how to do things with what it is that they have. So now we'd like to go ahead and take up the offering. And if oh, it's all done. Okay. Well, when we're going to have questions and answers, people will come up to the mic with a question, and please make it be a relatively short question, and then we'll let you stay up here, and you can give us our answers. So let's go ahead with that part of things, and make your question relatively brief, because we want to hear a speech from our speaker rather than more speeches from all of us.
Question, do you train, you're talking about volunteers, but are the trained now done by people from the country or from?
Yeah, that is a great question. And so we, in the last several years, we have really been working on the sustainability of the programs led by local leadership, and that's the leadership development that we've been working on for many years. And excitingly, in this past year, we were able to hold a training of trainers. So our co-founder Sherry Kirkpatrick, who developed the curriculum for training volunteer community health workers, was also able to teach and facilitate this curriculum and kind of the how-tos of hands-on teaching methods, working with village women on facilitating this with trained nurses. And so now this training for volunteer community health workers can be done locally within their local language and context, cultural context, because these women, they are all women nurses who were trained, know the local context of what is happening in these communities and are able to respond with a lot more fine-tuned detail. So that is the really exciting thing that we are now seeing in the sustainability of the programs moving forward and working with nurses and Health Ed Connect. Also, I should mention we also steward a scholarship nursing scholarship program, which was founded by a professional nurses association several years ago through nurses who were trained and worked at the SAN, if you're familiar with that, in Independence. And so we now are able to have the opportunity working with a committee of nurses who are professional nurses that go through the applications each year. And so over the years, nurses have received this scholarship and represent more than 10 countries. And many of them now, some are associated with our volunteer community health workers. And that was kind of this opportunity that I was noting in the last year, where volunteers that also live in these areas where our programs are and are eager to continue their now professional experience and provide that service within their community. So great question. Thank you.
Can you talk a little bit about the relationship between your organization and the governments in the countries in which you operate?
Yes, yeah. Um, Initially, I think when we got started, the impetus was led by local women who really just kind of needed a launching point. I remember Sherry saying, we have the passion, we just don't know how to package it. And that's kind of how it got started. But over time and through development, a lot of partnerships have taken place with local ministries of health, with professional doctors and nurses and clinics and hospitals. And so many of our volunteers do volunteer and serve at these locations, even though they don't hold professional degrees themselves. They are well recognized and highly respected by the local clinics because of their experience and advocacy in the communities themselves. And they have a high degree of trust with a lot of the women and families that they are working with. So many of the volunteers, while serving as volunteers at the clinic, are also kind of advocating and providing really credible information, for example, about vaccines in the communities, the efficacy of vaccines, and really trying to distill any inconsistencies in information that might be received. So those are some of the ways that they're really kind of going out in connection with in partnership with professional nurses and doctors in their areas to spread the information that is needed and most credible.
In your presentation, you mentioned, I think, WHO guidelines.
Yes.
Could you talk about that as well as any other guidelines that you have established? Can you talk about that?
Yeah. Yeah. So the curriculum that Sherry Kirkpatrick, our co-founder, developed was based on kind of these World Health Organization guidelines for village health in really rural areas. So, if you're familiar with, for example, the book Where There Is No Doctor, some of the concepts that are part of our trainings now, things that seem apparently simple to us, related to, for example, preventing illnesses through hand washing, or using oral rehydration solution to prevent, the uh, death through vomiting or diarrhea caused by dehydration, and really getting that started early on with kids. Those are some of the things that were the interventions that were embedded within the training, that is intended to be hands-on with the volunteers so that they're able to to learn in that hands-on way and go out and share that information and practices with the women and families that they're working with in their community. Did that get to your question? Okay, thank you.
Can you tell us a little bit more about more we why how we can get more people who are doing the kind of things that you're doing?
Mhm.
And and it takes not only the people who are doing the hands-on thing directly there, but it takes the people who can organize
Mhm.
all of this kind of thing happening.
Yeah.
So how how do we go about having more people doing the kind of leadership kind of things that you're working on as
Mhm.
well as working with the individual people?
Sure. Well, here on the home front, a big part of what we try to promote is education, awareness, advocacy about these important issues, and also about the work that we're doing to address these community needs in areas where there are vulnerable populations. And so we oftentimes work with quite a few civic groups or church groups who are providing a platform for this awareness and volunteerism through various ways, whether that means fundraising or friend raising, just to be aware about our work. Sometimes there are groups that help us with gathering up ointments. So sometimes when we really promote now through our funding to purchase supplies locally to support the local economy. But when we do travel on site, which isn't often, it might be once a year, but we will take some supplies with us. So we take some ointment, single or triple antibiotic ointment, and really talk about the importance of the steps of treating wound care. For example, the volunteers have been trained on how to start with making an antiseptic made from guava leaves, which is for most people very accessible and free for a lot of people, which is really important for teaching moms in the community how to make an, an ointment, an antiseptic ointment made from guava leaves and using that on the wounds and really starting with that and then working up if the wound is really a stubborn one to other methods of care such as the single antibiotic ointment to the triple because we are seeing a worldwide um, concern about antibiotic use and resistance to that so that's a big part of the education as well but sometimes we do for example take some of these ointments that groups have collected for us and take that where we go to see our volunteers and so a big piece of what we work on here in the U.S. in our base is sharing that awareness and advocacy about these really important topics and ways to get involved in this in supporting that. Thank you.
It seems that you've talked about a lot of costs just to maintain these programs and volunteers that spend a lot of time. Is there compensation that comes from the government to help these people? Are they earning salary or stipend from the government? And
Yeah.
does the government provide money for vaccines and other medicines?
Mhm. Great questions. Yes. So our foundation is in volunteerism, and so we are working with volunteer community health workers and training them through their experience and positive reputation of really being a positive advocate in the community and having some of these skills. Many of them have gone on and been selected for further training through the government. So some of them are receiving some form of remuneration through the government for example, some of the traditional birthing attendants at the birthing centers in the DRC, or some that are working at the clinics. It is not a lot. So I would not call it a full time salary by any means but through their work and recognition and positive reputation, have had some of these additional opportunities in their own development and for income generation for their family. We've also worked with some groups on different income generation strategies or things that they could make and how to sell those, and work with them on some entrepreneurial techniques involved with that. We've purchased some, for example, paper beads that we've sold over the years, and it's a way to promote their work and efforts, and some chitenge cloth material items that are sold and shared on their behalf. So we are involved in that work, but a lot of our programs are very cost effective on the ground, and so the value goes a long way in making a really long-term investment in people's lives through little costs on the programs themselves in a lot of these ways. Good question. Thank you.
I have a question from Alex Westerfield. It said, "What are some of the unexpected obstacles you discovered as you begin and continue your programming?"
Yeah, well, I think some of the obstacles that we face kind of in a headquarters format are just distance. So, intercultural language and sometimes, misinterpretation of how how we might interpret some of the things that they're saying. And I will say technology has improved significantly over the years to be able to kind of really hone in and whittle down on some of those obstacles and barriers. But I think that's always the challenge, but opportunity that we have in learning from one another. So the community health workers are my biggest teachers in what I am trying to learn and promote. And they have a lot more insight and knowledge than I do, and I know that in their community. So they are my teachers, and I think that's the real key, is in those challenges of some of those um, intercultural communication barriers that we seem to experience sometimes, is really just kind of going back and asking more questions to for learning, for our learning, to see what that means, and to go deeper into the issues that they have identified in their communities through community members. Thank you.
What kind of goals have you set, and how do you measure success in the various places in which you work?
Yeah. Yeah, that's a great question. The goals that we set, we work with our board of directors to set goals around our strategic plan, and some of that is challenging, to be honest, when you are a grassroots led organization. So we look at it from the standpoint of, okay, so what goals could we make in collaboration with our volunteer community health workers that they are leading, that relate to the reduction in, for example, maternal mortality, or the increase in students' academic achievement at school. And so through some of those processes, that's how, for example, the Girls Achievement Program got started, or the high school scholarships. And then it led to the tutoring program, because we were finding, oh, well, we have this such a nurturing program at our schools, and the community health workers are there, and we have all these wraparound supports, but we don't have the high schools. So when they go off, even though they have the scholarship that 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 is supported by Health Ed Connect, they weren't having some of that support system around them, and they were not succeeding at school. They were not performing well academically anymore because they didn't have that support system around them. And so that's how the Girls Achievement Program, or sorry, the Keeping in Touch Club got started, with a tutoring program and a tutor who had an understanding about the secondary school curriculum that could be involved in supporting them academically. So now we're seeing those scores increase students and they're performing better, being able to graduate. Because what a shame that for a while we were providing scholarships and then they weren't passing some of their exams. Why is that? So we really had, looking deeper at some of the key issues underneath that to continue to provide that wraparound support for them uh, to really succeed in their goals and feel like they still had a support system around them, because just cheering people on is one thing, but really supporting them through the next stages of their development was the next step that we needed to develop. So that was one example of a goal setting in terms of how to um, see improvements in the programs through the collaboration with our partners.
I'd like to talk you to talk just a little bit more about the ages of the persons that you're especially able to reach to be helpers, as well
Hmm.
as people that you're able to reach from here. And I'm thinking with my experience, young children think they can do anything.
Yeah.
And so they're ready to jump in, and it doesn't make any difference whether they're capable of doing it. They're ready to jump in and learn about it. And another group that tends to be very willing to do things are people who are recent parents who've been dealing with their children. And then we have the grandparents who have had all the experience. And I'm just wondering what you are finding in terms of how you reach people to help of different ages, as well
Mhm.
as how you reach the people who need the help.
Yeah, yeah. Well, I mean, I think some of the biggest advocates are children sometimes. There's one group through a congregation that supports Health Ed Connect, and they have a Young Peacemakers Club. So, there are some groups that they're talking about some of the issues that are being addressed by kids their own age in some of the places where we serve. And, what are some of the challenges that they face? How are we similar? How are we different? What are ways that we can support each other? And sometimes they write little letters to some of the kids at our schools that will deliver. And so those are just a ways of connecting. And then oftentimes they will take up an offering as well, so that they are also investing in the programs that are impacting kids like them in a different part of the world. So, I mean, we are connecting with people of all ages in terms of sharing information and awareness about our work, and locally, the community is involved and invested around these programs, to support the work of the health workers. I think one of the biggest endorsements of our health worker colleagues that we have noticed over the last several years is, in Malawi, starting in Malawi, uh, village chiefs were donating plots of land to the health worker groups because they wanted them to start a health center there. They said, "We've noticed all the work that you've been doing in our community over all of these years, and we, out of our respect for seeing the positive impact you're making in people's lives in our community, contributed this land to develop health centers." So now, there are four, through support, we've been able to develop four community health centers that are facilitated by the volunteer health workers themselves. And these are places of education for the community, for mothers and caregivers to come and do education with the Sinkani is the name of the group there, and weighings of the children, and then other community groups can use the center as well. So it's really a community supported center where a lot of things are happening, and different classes for all ages.
Well, if you were going to make specific suggestions to those of us who are sitting here of what would be something that someone could do,
Mhm.
make, give us some ideas of some specific things that people such as those of us here could do to help.
Yeah, thank you. Well, the biggest need that we have for our programs is in in terms of our financial support. So, awareness and advocacy about what we do, and then the financial support to help to those programs to be furthered and for sustainability of the programs. And so our website is healthedconnect.org, and donations can be made there on the website. And that's, I think, one of the best ways to support the work of Health Ed Connect. Thank you.
Thank you very much. We're going to go in the library for a little bit for people who want to have a little bit more discussion and who want to ask you questions. And some people may have their stories they want to tell about something that they remember that was helpful to them. So thank you so much for coming.
Thank you.
We'll move down to the library, and then after you're done there, then there is the true servant that's Helen Maywood. So thank you so much.
Thank you.
For coming and sharing.
Thank you. Appreciate it. Mhm. Thank you very much. Thank you very much. Yeah. So the store is to when I put out my finger in that right. People were something, so they wanted to show to write on the ground. Their legislators in the lot, something that children are going to read, so that some children from the Scouts and send out and helping people learn how to write a thing. They want to get some deal out people. What they found, one of the only persons feel kind of animals, they want to go over and see them and have a lunch or something. And so then they do that. And then pull in some people that way. And it's so it takes a great challenge. It's really a need.